Can a family strengths perspective transform the way that we approach rare disease? Thank you for joining me today. My name is Ann Johansson, and I'm a nurse practitioner in the Division of Genetic and Genomic Medicine at Children's Hospital of Pittsburgh, and the coordinator for the UPMC Interdisciplinary Prader-Willi Syndrome Clinic. I'd like to discuss leveraging family strengths in rare disease in honor of International Rare Disease Day. I'd like to set the stage by defining quality of life and health-related quality of life. The World Health Organization defines quality of life as an individual's perception of their position in life in the context of the culture and value systems in which they live, and in relation to their goals, expectations, standards, and concerns. The International Society for Quality of Life Research defines health-related quality of life as the health aspect of quality of life that focuses on people's level of ability, daily functioning, and ability to experience a fulfilling life. We know that decreased health-related quality of life has been documented in patients, their caregivers, and family members in multiple rare diseases. Adverse impacts to quality of life may come from disruptive symptoms and side effects from treatments, even if the treatments are helping some symptoms. It's hard to concentrate on work when you're experiencing distressing or distracting symptoms. The work you train for may no longer be an option if, for example, you're losing your sight from a rare retinal disease, or if you have shortness of breath on exertion from a cardiomyopathy. Caregivers report their own somatic symptoms, like decreased energy, headaches, nausea, and weakness, as well as emotional symptoms, like depression, anxiety, helplessness, and hopelessness. Also, cognitive difficulties like memory problems and difficulty thinking quickly, and strain on relationships has been documented. You know how hard it can be to think clearly when there's a lot on your plate, let alone caring for a loved one with a rare disease. And we must be careful to consider all members of the family and not just the primary caregiver. A father once said to me, just because I'm at work all day doesn't mean I'm not thinking about them and wondering how they're doing. One study of families affected by Prader-Willi syndrome, which is often characterized by the insatiable drive to eat, mood lability, and temper tantrums, even found that 92% of siblings of school-age and adolescent patients with Prader-Willi showed symptoms of post-traumatic stress disorder due to their siblings' behavioral difficulties. 92%. And recent research has uncovered disordered eating patterns in the siblings of children with Prader-Willi syndrome, attributed to growing up in a household with tight controls on food access. Here are several examples in the literature of patients and caregivers discussing the impacts on their quality of life. The mother of an individual with Prader-Willi syndrome says, "I feel stressed out. Raising a child with Prader-Willi syndrome has been a lot of work. I feel depressed and I cry a lot. Having a child with Prader-Willi definitely makes it harder to meet family obligations because I'm always stressed out about keeping the child away from food." An adult with osteogenesis imperfecta or brittle bone disease says, "I do cope with it because we have to, but you live with the anxiety on a daily basis." And a healthcare provider said of families affected by osteogenesis imperfecta, "I think certainly the newly diagnosed babies, the parents probably feel a little bit like they're the only person who's got OI in the world. And I've talked to many families who have been affected by Prader-Willi syndrome, and especially those who have new babies at home. They do feel really isolated and like they're the only ones who are feeling this way. So this is a problem for individual families, but why does it matter in the grander scheme? Decreased health-related quality of life has a larger impact on the community and society through lost productivity due to missed school or work, for appointments or hospitalizations. Many families aren't able to take off at a moment's notice or to find childcare for their other kids when their child with a rare disease has an emergency. Also, having symptoms that disrupt the ability to work can also mean slower skill accumulation and the increased wages that come with career progression and promotion. Studies have found that the physical and psychological sequelae of poor health-related quality of life can result in increased health-related expenditures, perhaps because of the effects of anxiety and depression on health, delayed treatments, and the decreased use or uptake of preventative care. Poor health-related quality of life also causes families to be less involved in recreational activities, like going out to eat, visiting attractions like the zoo or museums, which leads to lost revenue for these businesses. And families may be less likely to take part in cultural events, which deprives the community of their unique perspective. Another parent of a child with Prader-Willi syndrome says, "I don't have a social life because no one understands and can't relate to the stress involved. I can't go out to a party or out in public. Sometimes I feel like life is all work and no fun. I try to stay involved in work. I also take antidepressants and go to therapy for 1 hour a week." The parent of a child with a mucopolysaccharidosis says, "Even going on a trip in the car, it's like packing for a holiday. Sometimes with diapers, wipes, feed, emergency stuff, then getting her into the wheelchair van, up the ramp, securing her. When you're going out for a day, you make the most of it. So sometimes families don't go out." Thus far, I've talked a lot about deficits, but let's look at the other side of the coin. Although families affected by rare disease are at risk for decreased health-related quality of life, the challenges they face present the opportunity to grow. Although not all families are strong, all families have strengths, and I propose that these strengths can be leveraged to help improve family quality of life. What are family strengths? Family strengths are qualities that demonstrate commitment of family members to each other, and resources that help families to succeed in challenges through the life course. It's important to note that what's considered a strength is shaped by cultural diversity in a family's culture, although there are common foundational strengths across cultures. Strengths are not stagnant, but evolve as families go through different stages of life. Previous research looking at family strengths in different cultures have found that families that exhibit strengths like appreciation, affection, flexibility, truthfulness, hope, time together, positive communication, and spiritual well-being in whatever form that takes for the family, are better able to cope with challenges they face and contribute to their community. As John Dufresne and Sylvia Assay wrote, "Strong families are critical to the development of strong communities, and strong communities promote and nurture strong families." Very little has been published in the literature about using family strengths to improve quality of life in rare disease. I would like to find out what strengths are common among rare disease families. Are strengths similar or different depending on the type of rare disease, like a neurodevelopmental disorder versus a familial cardiomyopathy versus a hereditary cancer syndrome? Are strengths different in families where the disorder is present in multiple generations rather than de novo or present in only one individual? What about disorders that have targeted treatments and those that do not? Or what about those that may result in a decreased length of life versus those that don't directly affect the length of life? Do families exhibit different strengths in these circumstances? And how do strengths help families get through difficult treatment regimens, like gene therapy? Can we help families affected by rare disease to identify and develop strengths to improve their quality of life? One idea is using something like an event history calendar and a goal-making intervention to help families to reflect back on the past 2 weeks, 4 weeks, 6 weeks. Think about what kinds of situations their families were in and what sorts of strengths they used, or what kinds of strengths they could have used, and then making goals for the future. Also, can we teach rare disease families to help other families to develop strengths? Stay tuned, and I challenge you to start thinking about how family strengths can be integrated into research and clinical care for families affected by rare disease. I'd like to thank my family nurse mentors, Dr. Cindy Danford at the Cleveland Clinic and Dr. Lindsay Smith at Charles Stewart University. I'd also like to thank the Interdisciplinary Prader-Willi Syndrome Clinic staff and families, and also my mentors from the Division of Genetic and Genomic Medicine and the Center for Rare Disease Therapy at Children's Hospital of Pittsburgh. If you'd like to learn more about anything I talked about today, here are some references that I used where you can find more information about quality of life, family strengths, and rare diseases. Please also get in touch with me with any questions or if you'd like to collaborate.